Okay, everybody, let's get ready to start. Our next panel, we got Tiffany Vora, Kenton Jarvie, Bart de Witte, and it's moderated by Hugo Diaz. This panel is about disrupting healthcare, the future of health tech and patient-centric innovations. I'm going to talk a little bit about our panelists. First, we got Hugo Diaz, who is an innovative entrepreneur with extensive experience in launching successful businesses across 9 countries and expertise in B2B sales, healthcare, technology, SaaS, and more. We also have Dr. Tiffany Vora. She is chair of Singularity University, empowers women in STEM, contributes to biology and medicine advancements, and holds a PhD from Princeton with teaching experience at its esteemed institutions. Kenton Jarvie brings his entrepreneurial experience to Side Door Ventures as a seed stage investor, focusing on early stage startups across industries. And last, we got Bart de Witte, founder of the Hippo AI Foundation. He's an accomplished healthcare technology and innovation expert who advises governments, holds think tank positions, and actively shares insights through his newsletter, Hippogram. So let's discover the future of healthcare through cutting-edge innovations like digital health, telemedicine, AI-driven precision medicine, wearables, IoT, and patient-centered care in this insightful panel discussion. Please, a warm welcome to our guests.
Thank you, and welcome everybody. So we're excited to talk about this topic, that it's a very interesting topic because everybody thinks that healthcare should be further than it is, and we're wondering why it isn't. And I'm going to tell a quick story because 12 years ago, 13 years ago, I moved to the US to do my MBA, and I decided to start a healthcare startup. And it was because I felt that it was just lagging behind in technology, so I decided, okay, let's do this. 5 years into it, I realized why it wasn't. There was a lot of regulation, and we're going to talk about this, but disrupting healthcare. It's something we want to discuss today, and I want to begin with what is the disruption that we're expecting in healthcare? What is disruption, and what do we expect to see in healthcare? Bart?
Disruption. I've been working long in the field. The first time I was in Silicon Valley was in 2004, watching all these pitch decks. We're going to disrupt healthcare. I honestly haven't seen it happening. Nobody has disrupted healthcare because you look at the metrics. We have higher costs, like at the time, 2004, the total cost of healthcare in the US was 14% of the GDP. Now we are 20%, life expectancy is going down, access is not there. So I don't see the disruption in that sense. We all know disruption from our mobile phones and technology, where we are following Moore's law, and there is a research paper in healthcare that talks about Eroom's law. That is Moore's law spelled the other way around, because in healthcare everything gets not that more performant, but way more costly in that sense. So I think there is a huge disruption ahead, but it hasn't happened. And I believe that generative AI and the ability not to be able to patent what AI creates is going to lead to disruption. If we cannot patent art, patent books, we will not be able to patent proteins, molecules, and all these other things. And I think that will cause a huge disruption in that sense.
Thank you, Bart. Anybody else want to comment on the type of disruption you want to see?
So I think an important point here is thinking about what is the fundamental job to be done, what is the fundamental problem that we're trying to solve. And when it comes to healthcare, the fundamental job to be done, I would argue, hasn't really changed in thousands of years, right? The job to be done is to go to someone who knows more than you do, to have help preventing yourself from getting sick, treating yourself once you get sick, and living the longest, healthiest lives we possibly can with the people that we love. That's the fundamentals of healthcare. So I just want to ask how well that job is being done today. Raise your hand if you absolutely love your healthcare. Nadia? One in the back. Okay, excellent. One in the front here. That's right. We're going to come interview you later to find out what's working.
You're probably very healthy.
Right. So I think what we can see here is, even though we think of disruption happening with these new technologies, which are super exciting, and Bart's arguing that they're not actualizing the change we need to see in healthcare, fundamentally the job to be done is the same, and it's a job that's about people.
All right. And I also want to talk about what it means to be patient-centric, because that's the other important thing in our discussion today. Because we all want to see more healthcare that is not like the industrial age type of like, oh, everybody gets the same. All the people talk about personalized healthcare. What are you seeing already out there? I guess I want to start with you, Tiffany, since you're in Silicon Valley seeing a lot of innovation. What are you seeing out there that you think it's promising in terms of patient-centric healthcare?
So I think there's two separate pieces that I want to look at here. One is where you started, which is thinking about the personalization. So I'm seeing lots of really interesting startups, but also legacy companies that are really trying to look at who I am as an individual. That could be looking at my DNA sequence. It could be looking at my blood metabolomics. It could be looking at my food and my exercise and the drugs that I'm taking. All these things come together in a way that gets processed, makes it sound inhuman, but integrated through my own biology. So there's companies that you can go to today that will take a bunch of data from you and then give you some sort of risk score for something. I don't think that technology is quite ready yet for prime time, but I think we're in one of these virtuous data cycles, and I'd love to hear more about how this, how you see this coming out, where the more types of these data we get, the better our statistical models can become at making predictions for what could happen in the future. Some of these are classical statistical models. We've also got folks who are using really advanced AI models to basically say, okay, hey, Tiffany, you do all these things. Here's what you should be on the lookout for in the next 6 months, year, 2 years, 5 years, and so on. So I think that's really great. That's personalized. I don't know how person-centric that is. So for me, being person-centric means that the human relationship is the core of what we're doing with technology, is the core of any time I touch the healthcare system. So if any of you are doctors, I will warn you, you do not want me as your patient. I am the worst patient, because the first thing I do when I walk into the door to see my doctor, I get 7 minutes with her. I know all the statistics. I say to her, please take your hands off the keyboard and look me in the eyes when I'm talking to you. And usually there is this moment of aggression and unhappiness, and then we reset, and then we're actually having a conversation. Then she's actually putting her hands on me. Then we're figuring out where to go from there. And for me, that's the patient-centric part of it. And also remember, for our healthcare providers, I was at a hospital in India interviewing people, and the doctors, the nurses, the staff, they all told me the same thing. They said, we didn't come into healthcare to fill out paperwork. We came into healthcare to help people. So I'm also excited about the technologies in healthcare that are helping the provider side as well. Doctors, nurses, physiotherapists, all these folks actually getting to spend time with the patients, doing the part of the job that I'm going to argue for the foreseeable future will not be taken over by AI or by robots.
Yeah, and this is where AI and automation play an important role to reduce the amount of time that providers and caregivers have to spend doing those repetitive tasks, if you may. Go ahead, Kenton, you wanted to say something?
I'd love to respond. So last week I was in San Francisco at a YC event, and Sam Altman, founder of OpenAI, was there giving a talk. And so despite this challenge of disruption, maybe I can plant a little seed of optimism. It was an amazing conversation, right? Like, I think we've all probably played around with ChatGPT and see the personalized opportunity that is there. And so he's very bullish on problems such as, administrative or these types of challenges that these technologies can step in with. And the question that he's asking and his team is really looking forward to next is, can we give them a problem that a human hasn't solved? Can we give them the problem of cancer? Can we give them the problem of gravity and time travel? Like these outlandish ideas. And that's what he's really excited about. And it got me inspired to say, what is this technology going to look like with problems that we haven't solved yet? And at bare minimum, this technology is going to fill in gaps, allow us to run tests quicker, advance the technology with human support. But there's even a broader future there. And so I think this personalized element is exciting for where we're headed.
Yeah, lately I've been discussing a lot the term curated human touch. So how do you use the automation and the AI to do all the stuff that doesn't need a human, but you have the human at the center to serve the patient. Now, there's a big barrier that we all know we have, and I want to hear about it in terms of the data, right? Because you need the data in order to do that patient-centric and personalization. And at least in the US, I mean, one of the things I learned was like the restriction with what's called PHI, right? It's really huge. I remember they would tell me you can't send a text or an email with patient information, but you can send a fax. I mean, that's how ridiculous is that, right? But I want to hear what initiatives, and especially globally, not just in the US, and since you're in Germany, I know you're involved in some initiatives, to be able to have access to that data, and how can we use that data in a way that advances healthcare forward?
Yeah, getting data is really complicated. I've been working on it since a long time. Healthcare is a bit organized like Game of Thrones. We have all kingdoms fighting each other, and nobody looks at the broader perspective. And I think in 20 years or 30 years from now, our children will ask why did we took so long to get all that data together, because there's so much cure in that data. But as we see data as something competitive and something that equals capital, it starts to become less accessible. And I think that's a huge problem. We are even accelerating the inability to get access to data by giving a price to data in that sense, and making it exclusive. I'll give you an example. There is an academic hospital in Berlin where I live, where oncologists working in that hospital want to get access to data. They have to request access to a big pharma company who already got exclusive access to that data. So AI and data are getting in a relation. That means that AI is getting information or knowledge out of the data, and then after that, the data is being held exclusive. So I think we need to work on new licenses. I've been working with the Creative Commons Foundation, Creative Commons and the Open Source Initiative to see if we can create something like a copyleft license, where we turn patient consent into copyleft licenses. That means that everything that we share as data cannot be held exclusive, and creates then open ecosystems where data starts to flow. And we haven't solved it yet because there is so much hunger for becoming creating the biggest information asymmetry, and then becoming more powerful in that sense. And I think patients should become more involved. Patients should become more visible in that perspective by giving consent, by allowing them to donate their data and get access to their data. And that is not even the case. So we are working now on a large language model, an open source model. We have 120 hospitals lined up for creating something that is similar to MedPound from Google. But getting access to data is still a huge challenge, and it's not becoming easier.
Mm-hmm. And this is where I want to touch one last point before we open it to questions from the public, but it is collaboration. How can we collaborate to be able to use data in some cases, or I guess go around the regulation, because as I said, in the US we have that much regulation, but here in Guatemala you could do a lot of things. There's not a lot of regulation. So how can we create some kind of global collaboration to innovate in healthcare?
Yeah, well, maybe I'll share a little bit of my story. So my wife's a nurse, and I watched her go through all the challenges of short staffing, burnout, and just this. She's very caring. Like Tiffany, your example of like, seeing them people in the eyes. She'd come home and talk about doctors, all this kind of stuff. And so it's a very challenging work environment. And so my background here is not in healthcare at all. I'm not as smart as my esteemed colleagues over here. But I saw this problem and this nursing challenge. And when we started to look through it, it was the question of, well, there are some amazing people around the world who are nurses globally. And there is an imbalance. Some countries have more, some countries have less. Some countries are able to produce more nurses with their programs, their education. And what we decided to do was help out the American healthcare system, which has hundreds of thousands of nurses short, and find a way to bring people to America. And it's a very challenging thing to do. And so we basically built software to help with immigration and licensing for that. And I think that what I'm excited about here, and some of the challenges that we talked about, technology is going to fill some gaps, right? And as Tiffany mentioned, there's a human patient-centric care that's not going away anytime soon. And if we don't have people, then we can't take care of our people. And I think that's a really tough thing to do. And so some of the regulatory challenges, education, allowing people to immigrate, et cetera, they're difficult. And so coming from outside of this world, I didn't know anything, and we just started kind of cracking away at it and finding different ways of doing this. And now, last month, we added 450 nurses from around the world who are helping to join the program and move to America. So
if anybody here knows a nurse, that's an opportunity there. Anyway, I'm going to open it up now for questions from the public. Yes, Gabriel. A microphone, please. Can somebody give him my, no.
Somebody was saying on the panel that AI will help with regulatory compliance. I see that as a negative in a way, because what that forces us, it doesn't matter how much increased regulation we have, oh, now we have a tool to deal with it. So really my question is around, do you guys see regulation increasing to be layered on in systems throughout the world, especially in the first world, which is what we in Latin America follow? Do you see it tapering down? Because that has a huge effect, I think, on the quality and the speed of deployment of new medicine. I was just stunned to hear about Eram's Law, which some of you may have heard of, which is Moore's Law upside down as it relates to healthcare. So what's your opinion on the regulatory environment? And
thank you for that question. It sounds crazy, but in Europe there is the AI Act, and there is a lot of discussion about regulatory capturing, about big companies working together with governments, trying to regulate it. And they want to institutionalize the research process from generative AI, which would be an absolutely killer and slow down of innovation. So exactly what your point is, like there is this huge hunger for over-regulating it again, and it will slow down again innovation. Everybody here talks about in Guatemala we can disrupt and we can build solutions, and we forget what was the core that we can do this is because we democratize software. Coding is something that completely got democratized. And in healthcare, we don't democratize anything. As I mentioned, we are confronted with feudal lords and Game of Thrones. It's all kingdoms fighting each other, and we are some sort of subject. So I think we are starting a petition in Europe to fight the AI Act, to make it more visible. It is absolutely nuts that if you want to fine-tune a Llama model, which is an open source language model, and you want to publish it on GitHub, this is going to cost you $200,000 because of the quality management system you need in order to publish it. So they're going to kill all open source innovation, something which I've been working on since 4 years. So I absolutely agree that regulation is a huge threat for accelerating innovation, but it's also about protecting the kingdoms in that sense. So we need way more bottom-up movements in that sense.
I'm going to argue a slightly different point here, which is that in healthcare in particular, regulation has a really important role to play. We're talking about people's lives. We're talking about their bodies. There are real-world consequences in ways that I, as an extremely biased biologist, think don't apply in many other realms. So I think there's definitely a place for regulation, particularly in the healthcare realm. What you should do is keep your eyes open in the coming years, because there are at least 3 natural experiments going on right now with big regulatory bodies or governments taking very different approaches. So you just heard a bit about the European approach, right? There's also the approach in China, which is a very authoritarian approach. And then there's the approach with the United States right now. That's where I'm from. I live in California. We tend to swing a little more European, but the US as a federal state doesn't seem to know which way to jump just yet. And we've just had hearings in front of our Congress recently with these tech folks talking about these various things and what kinds of regulation needs to happen. So what's going to happen? I don't know the answer to that. I have opinions about what they should be. But what's important is that in Latin America, for example, you're right, you're watching these natural experiments going on. So you have an opportunity to be having multi-stakeholder dialogues to really nail down what is the future that you're trying to build? What is the end state? What does healthcare look like in 20 years? When you know what that vision is, then you can say, what do we have to do 15 years from now to make that happen? 10 years from now, 5 years from now, 2 years from now. And I think the goal of regulation should be to enable as many possible positive futures as we can, rather than think about it as a whack-a-mole approach to cutting off negative futures. That's how I look at it.
Mm-hmm. Yeah, I'm happy to chime in quickly here. I obviously come from the startup hacky world, and so how does that get balanced? And I can't agree with Tiffany more. Like, this is human life that we're talking about, right? This isn't like you're jumping in a car at an Uber and you're breaking all the city laws. So I think you've got to balance that. And I think that maybe how I think about it, and maybe you see that in the work I'm doing, is there's certain types of work in healthcare that we can do and we can push the boundaries. And so wherever you are, whoever you are, you have that opportunity. There's a ton of regulation. It's getting worse, in my experience. And so, what does that mean over time? Like you have all this red tape, this baggage, and that builds up, and so that can be difficult. But where can you push the boundaries? I think that's maybe the question that I'd like to ask. And how do you keep people safe at the same time?
You want to say something about it too?
Yeah, let me just add something. There is a difference between pre-deployment regulations and post-deployment. So I'm all for when things get in application regulated. But what I talked about was regulating research, and that's a different take. So, and the second thing about your long perspective, I absolutely agree, and I think we can learn a lot during the COVID phase, because there's one thing that makes people collaborate is when you have a joint enemy. Like Germany unified against, because the war against France, and the Bavarians and the Prussians and the Swabians united Germany. Now with the war in Russia, we united again. So this enemy perspective allowed us to start sharing. We have never seen so many open sharing, open data collaboratives as during COVID, because there was something that was threatening us, threatening our freedom. And I think we need on a global scale to define what is that joint enemy we want to conquer. And I think perhaps it's disease or whatever, but we haven't found it out yet. And I think we need to define that as a global, not from the US only, Europe. So we start collaborating on a global scale, because that's not happening either. We have this rubber band effect after COVID. We learned a lot and we let it go and we're back to start at the beginning.
Yeah, now I want to challenge this thought a little bit because, I mean, from the standpoint of what I mentioned earlier, the HIPAA regulation, I felt like that was just hindering innovation completely, right? And outdated, and how do you keep up with the changes? It's similar to the conversation about AI, and do we regulate AI or not? And the defenders are saying, if you regulate it, you're going to slow down innovation, and somewhere else, innovation is going to happen, right? And I know Gabriel asked, he's leading a project of autonomous, like an autonomous territory in Honduras, where you can take a startup and go and be free of a bunch of that regulation, right? So how do you, is that a good thing for the innovation in healthcare? How would you feel about innovation going elsewhere?
Well, look, I mean, innovation is going to go elsewhere, right? As long as we have innovators who are fundamentally hamstrung by regulations like HIPAA, you're going to take your innovation and you're going to go somewhere where you can actually do the work and run the experiments to find out what's happening. Again, biologist, to me, that sounds kind of like survival of the fittest and natural selection, so I want to say, sure, go ahead. But I think there's also ways that we can run small experiments that aren't necessarily obvious, that get through under the bar of some of these regulatory things where we can actually try things out. But it's hard. I mean, what I have to go through just to get my healthcare provider to give me my own data, my favorite thing is when they say, oh, it might upset you. And I'm like, oh, is this because I'm a girl that you don't want to tell me? Or because you think I'm not smart? Like, are you kidding me? Like, again, you do not want to be my doctor. So there are ways we can do this. But I think it's also really important for us to remember that the regulations that we labor under today, like HIPAA, made sense when they were crafted. And now the world is fundamentally different. And when we think of the world as being a linear change, that's kind of how we're used to thinking. But now, thanks to technology, everything is an exponential change. So we are fundamentally hindered in our mindsets, in our systems, in our processes, in our regulations. And I think that's where folks like you have the chance to really make a difference.
Mm-hmm. Exactly. All right, I think we have time for one more question. Go ahead. Or do we have time for two? How are we? Okay.
Thank you so much. One additional change that's happening in healthcare, and for the longest time, this promise of moving away from fee-based to value-based, which also includes the payer part of this. I would like to hear your opinion. Where are we in terms of that transformation and that transition from fee-based to value-based? Thank you.
And just for the audience, if you're not familiar with this, because this is a term that is being used in the US a lot, like fee-based is how providers are being paid, doctors are being paid by the visit. So only like if you see the patient, you get paid. Value-based is more like, are your patients healthy? And there are some initiatives about paying doctors for a population of patients who are healthy. Go ahead.
So the simplest way to think of that is fee-based is sick care, and value-based is, at least in theory, true health care. So I am seeing a shift in at least the language that people are using, right? Talking more about preventive medicine, trying to make sure you're treating the underlying mechanism of what's going on, not just the symptoms. I hear a lot of talk about that, but frankly, where the rubber meets the road in the big healthcare systems, it is still nearly impossible to get a physician to take a truly preventive healthcare approach, right? I saw this up and down for me. Again, I'm in the Kaiser Permanente system, which is one of the biggest systems that there is. And I remember arguing with a neurologist about wanting a blood test that was a consumer blood test, $500. I was like, I will even pay the money. I just need you to order it so that we can get this data. And she said, yeah, but you don't have any symptoms. And I was like, so the way preventive healthcare works is we don't wait until I have irreversible brain damage before, coming in there. And she goes, yeah, there's just not a box I can check on the computer. And I was like, I'm losing my mind right here. Like, I can't handle that. So there's still so much to do. Now, places where you can see that, of course, are if folks have money to throw at this problem. So if you go to a concierge doctor in San Francisco, in New York, in DC, in Chicago, sure, they'll give you Ozempic all day and all these various things, and you're going to pay for it. But you'll have access to these more preventive techniques, whether it's dietary, whether it's exercise, whether it's sleep. By the way, how many of you think you get enough high-quality sleep every day? Bless you, my friend. Okay, good. So we talk a lot about healthcare and tech and data and AI and robotics and all these really fancy things, but there's tons of low-hanging fruit that we're still not using seriously in healthcare. Some of that is literally fruit, right? Like, I was talking to one of the largest healthcare systems in Brazil, and they said, what should we invest in? Should we invest in stem cells? Should we invest in CRISPR? And I was like, you should send a box of vegetables to every family in your healthcare system every week. That's what you should do. So there's still so much value that we can get from pretty simple, low-tech innovations.
And on that point, I would like to add, concierge medicine is starting at the top, right? If you have the money to pay the doctor. I have a very good friend who's a doctor, a concierge doctor. And, but I think that innovation is going to trickle down eventually, right? It's just like cell phones. They started super expensive and only people who could afford to have them. Eventually, that type of concierge service is what will become value-based. And I'm more on the entrepreneurial free market. We'll figure out a way to get into it. And I think that's already happening. And we'll see as technology improves how concierge doctors will be able to provide better personalized care at a much lower cost.
Yeah, I'm not interested in a world where billionaires leave to be 200 and everyone else is screwed. Like, that's not a future I'm signing up for. So that's why I go around the world talking to folks like you, trying to figure out how do we accelerate this trickle-down process so it is the many who can benefit and not just the fortunate.
All right, one more question. Joey. Sorry. You need a microphone, please.
We can repeat.
Thanks. How do you guys see the wearables being kind of the future for everyone being kind of mandatory so that it gives you data to predict if you're getting enough sleep, for example, and stuff like that, versus, and driving down my premiums because I'm doing things well, versus being kind of big brother-ish control and stuff like that.
Do you want to speak to that? Wearables.
Well, I was part of the quantified self movement in 2009, and I tracked everything what I could track. Wearables can help for clinical trials that they collect some sort of data, but if you really look at all healthcare, I don't think they are that crucial in that sense. They also, based on my personal experience, my father was wearing an Apple Watch. He's 80, and he was laying in his sofa, nearly as white as a sofa when my mother came over and said, what's happening? And he was looking at his watch. I was like, well, I don't feel well. And he was looking at his watch. And 1 hour later, he was operated with 3 stents because he had a heart attack, a cardiac arrest, because he had so much trust in his Apple Watch. Although the watch was telling him at the beginning when he installed it, I don't do tracking, I do only cardiofibrillation. So there is a certain function for these wearables. There's also implantables that will come in a sense. They will be part of the data collection. But I think the future will be way more on the biotech side. A friend of mine is creating a new startup. He just received 100 million in funding. He's one of the originators of the Attention is All You Need paper, Jakob Uskereit. And his dream is to kind of prompt the function of a protein, then create a sequence and put it in an RNA vaccine. And I think these things are going to really truly change healthcare, and way more as wearables.
Yeah, I think it's important to remember that these wearables that we have today, these are tools. They're not deciders, right? So choosing to not go to the emergency room because your watch says you're okay, that's a problem. Going to the emergency room because your watch says you're not okay, but maybe you have no other symptoms, that's a whole other problem. So for me, it's about an ecosystem of signals. And I view wearables as being part of that ecosystem. How many of you are wearing something today? Apple Watch, Garmin, whatever it is? Yeah, a lot of us, right? If you get any piece of value out of that, that's a great thing, but becoming so focused on what your data is telling you that you're missing the big picture, that's a losing bet. So stay tuned is what I want to say.
All right, they're telling us time is up, but I hope that some ideas sparked some interest here in solving this complex problem. Healthcare is a complex problem, and as such, I think it needs entrepreneurs to figure out a solution through a network of ideas. So thank you all for participating here. Thank you for your ideas.